Hello and welcome to the ABFM Podcast, exploring the Family Medicine Factbook 2.0 series. In this series, we will discuss the specialty of family medicine, family physicians themselves, what they are doing in practice, how it's changing over time, and who they are serving and working with. I'm your host, Dr. Gary LeRoy, ABFM's Senior Vice President for Diplomatic Experience, and I'm thrilled to kick off this brand new series dedicated to the second edition to the Family Medicine Factbook. The Family Medicine Factbook is more than a data collection that highlights the depth, diversity, and impact of family medicine nationwide. This series features conversations with its creators and contributors. It explores how the Factbook informs decisions, supports advocacy, and drives meaningful change for patients, physicians, administrators, and policymakers. Our guest today for the first episode in exploring the Family Medicine Factbook 2.0 is Dr. Andrew Bazemore. He's the Senior Vice President of Research and Policy for the Centers for Professionalism and Values. And Dr. Bazemore, I'm really excited to actually have you here today as our first guest, and just tell us a little bit about you.
Well, thanks, Gary. Great to be here having the conversation. As you noted, wear a few hats for the American Board of Family Medicine as a Senior Vice President for Research and Policy, as a co-director for about a 6-year-old Center for Professionalism and Value in Healthcare. That's based in Washington, D.C., and then I have the joy of helping to oversee a lot of our leadership and scholarship programs, working with the Piscataway Leadership Foundation, Puffer Fellows, Visiting Scholars Program, and even hosting health policy fellows at our center in D.C., and still practice a day a week.
Tell us a little bit about you as an individual.
Perfect. Well, as a family physician, I should tell you my family has 4 children, the last of which has just started college and will be coming home for the holidays.
Congratulations.
Well, thank you. Looking forward to having them. I have enjoyed working for the board and with this group for about 6 years. Have been in D.C. for about 20. I used to work with the Robert Graham Center, which is another policy-facing, evidence-making body with the American Academy of Family Physicians. And gosh, I spend a lot of time outside of the office in the woods, hiking, backpacking, sailing, doing anything I can to, keep the mind and body fresh for the work we do here for the board.
Yeah, I kind of, when I think about you, Andrew, I think about the Renaissance man. You do a little bit of everything for everyone. And
I think it's just called family medicine. You do the same thing. That's right.
It's family medicine. And so there's a lot of part of the reason I ask about you and the center is that I'm not really sure a lot of the physicians and the public know about the center or what the extent of what family medicine does, a family physician does. We're not one-dimensional at all. And I think that's part of what this fact book is all about. We had one version of it, the initial version. When did that first one come out?
Put that out, really launched it in 2023. And to tie it back to the center, you're right. The board has long decided that operating within a certification space alone without trying to change the environment that our diplomates work in and the patients that they serve need to thrive in requires more of a commitment to research, to policy-facing evidence-making, and to making sure that the world knows really what a family physician is and what that title means. And that requires understanding us from a really broad lens, and that's what the fact book's trying to do.
So I'm assuming that the first fact book must have been pretty successful in that you're pivoting to a 2.0. Why a 2.0?
Well, I'll back up just to say the first fact book recognized that if we're going to ask our diplomates at multiple points in their careers when they engage with the board to fill out survey items that tell us about themselves, tell us about their practice, the patients they serve, their frustrations. We ask questions about how's your health IT serving you and your patients right now, for example. That if they're going to go to that trouble and we're going to turn it into research, we also need to put it in the hands of a lay community of policymakers in really simple terms, and that's what birthed the first fact book. And I would say it's a success. It wasn't something that someone paid for. necessarily even ask for. We just thought it's time to put out there something that can sit on a coffee table or in this digital age in a very easy to digest web space. And we've definitely found, as your team has helped us to learn, that people are using it, that they say this is a simple, easily referenceable way of understanding the discipline of family medicine. So
another question I'd like to ask, why would our board, the American Board of Family Medicine, be interested in co-sponsoring a Factbook 2.0? What questions are we trying to answer?
I think that's a great question, Gary. And you know and I know that facts are increasingly under siege. They're not enough that we can rely on. And I think our board's aware that our diplomates face an environment where there is too much disinformation and not enough reliable information. And that includes about our own discipline. And the board recognizes that if it's going to help our diplomates achieve high-performing primary care that they're trained for and capable of, we have to be a contributor to that environment. And so putting out something that is built on the voice of the diplomates, and not just one or two of them, but all of our diplomates in some way, form, or fashion inform this fact book. So their information getting to the hands of the people who can change our healthcare system, we see as of critical importance. And that's why we're investing in this fact book. We know our research matters, but we need the facts and we need basic information about family medicine available to anyone who wants to see it, anywhere, anytime.
So that's a great background as to what the fact book is about. So it's not just for family physicians to use. It sounds like I hear policymakers are using it. Would this be something that students or residents or faculty members would use?
It's a great question. I think when we look at this, we imagine that the family physician user, if there is one, is probably using it not because they don't understand family medicine, but because they need an easy way to communicate it to someone else. I'll start with your learner. We have actually done interviews and focus groups as we prepare for 2.0 to ask the med student, is this useful? How have you used it? How would you use it? We've heard pretty clearly that med students want more information as they choose careers in medicine about every discipline they go in. And they've told us this is unique. They're just not finding this for some of the other disciplines at this kind of depth, and they want more. And their use is pretty obvious. I really am about to make a 30 to 40 year decision based on a lot of investment. I'd like to know everything from the demographics, by gender and race and ethnicity and other background. Who's going into family medicine? What are they doing? What does their career compensation look like? How are they feeling about their discipline? We actually talk about burnout. Try to be very transparent in the things we know about ourselves. What's their scope? I hear this family medicine generalist can really do a lot of things. In reality, what do their practitioners actually say they're out there doing? And so for the med student, it's a way of knowing a discipline in ways that they might not otherwise learn it, even though they get exposure in med school. For the policymaker, to uses, it's an opportunity to, when you hear primary care as the solution, and we know it is, and you've gotten to know certain parts of primary care, really understand what does family medicine specifically bring to primary care. And I think through the fact book, it becomes a lot easier to have conversations if you're a family physician or someone who really believes in the discipline about how important it is to have the widest trained in both breadth and in depth, the most geographically dispersed of all the physician groups laid out before you. So if you're in a conversation saying, if we're going to support primary care and family physicians specifically, we need these things, it helps to have something you can bring along or point someone to better understand who we are. And then in between, I don't think the deans of medical schools, county health officials, the heads of hospital systems probably know us as well as they should. And this is not a standalone way of knowing us, but it certainly hopefully and certainly helps to contribute this. I'll back that up. This is not going to be something that by itself can communicate everything we need to about family medicine, but if you pair it up with a good story, it's the kind of book that can round out the edges with real data and real numbers about who we are and what we do and why we are so important to solving the major problems that our health system faces. So,
wow, that's great. It kind of reminds me of a student that approached me. I think this was in Wyoming, and this was a first-year medical student, and just kind of came over to our booth for the American Board of Family Medicine and asked us, so what is family medicine? What's the specialty of family medicine, and what does it do? And actually, I kind of reflected back to some things I read in your fact book, and just basically told her about some of the demographics and background of family medicine. And she walked away. Before she walked away, she says, I'm going to have to rethink this whole thing about family medicine. And I have personally used that Factbook 1.0 when diplomates have asked me specific questions about family medicine and how it works and such. And so when I'm writing some of the verbiage back to them, I will actually go and find some facts in the Factbook and kind of quote that. So that is fantastic. Is there anything that you can tell us about the background of the Factbook 2.0 before it's launched? Like, when is it going to be launched?
Well, we hope to have this soft launched, if you will, in early 2026. By soft launch, I mean we're going to make sure we present it back to some of our key partners, our own board of directors for the ABFM, those that work in the state chapter environment, that work in the AAFP, so that some folks can take a look at it first and say, we think you got this right. We like the way you've changed the language. We like the way that this communicates, the data and the information that are within it. And then by late spring, what I'd call a hard launch. We like to put this out in national meetings, probably starting with our Society of Teachers of Family Medicine and moving through a series of meetings from there. And we'd hope to see a lot of dissemination opportunities, a lot of chances to reach those audiences, from state chapters to educators to the students themselves throughout the year that follows.
I'm going to pivot a little bit back to the first version as far as, do you have any particular examples of how the first edition was used by, you mentioned teachers and researchers, any examples of how they used that first version?
No, absolutely. So in doing the due diligence to set up a second version, we talked to a number of our audience, of those who we would see as our audience. So at the national level, in going to Capitol Hill to discuss with Congress big issues that face family medicine, we've been told that this was a really useful, they call them a leave behind.
Oh, okay.
You have a conversation, you're speaking to ways to support the discipline in primary care, and you say, do you really understand family medicine and what we do? And the Factbook can fill a gap that otherwise would take a lot of time in communication, and also give someone who is a potentially 24, 25-year-old legislative staff member and has no reason to understand family medicine, a resource to go back to when you're engaging in conversations that follow. I think similarly, state chapters in each of their state capitals have noted to me this is a really effective way when they talk to legislators, to those in the governor's office, even to payers in their state, to better understand who we are, what we're doing, also debunk some myths about us. At the med student level, we heard from those who had found the Factbook. It's a real goal to make sure that more of them find it, and I'll get to that in a moment, that med students are using this in their decision-making process and better understanding who we are and why they might want to choose family medicine as a discipline. And then in between, I have personally found the payer community, those who are interested in measuring what matters to family medicine, can walk away with a better idea of the dimensions of the discipline, what we are, what we aren't, what we're capable of being. Sometimes we're trained to do far more than we're actually allowed to do. And so having the ability to change payer mindset about family medicine's capacity is a real important component of the Factbook too.
Yeah, it sounds like you are talking about, in part, using the Factbook, especially this new iteration of it, to help shape the future of family medicine. How do you see the Factbook actually helping? And you've touched on some of those things. It kind of reminds me of that old television show Dragnet. Just the facts, ma'am, just the facts. So how can I, as a family physician, use the Factbook to help shape the future of family medicine?
Well, I think you hit the nail on the head there, Gary. It doesn't take away our obligation and our center within the board to keep producing top-level research, to be present in all sorts of national, state, and local meetings that shape our discipline. But it sure does help to have a just the facts approach to how many of us there are, specifically where we're working, the kinds of services we deliver. I'd like to think we all have the memories to keep all that as walk-around knowledge. The reality is we don't. And many of us don't have the access to the data resource that our diplomates have given the ABFM. So this is a way of paying that back. And in terms of advancing the discipline, it does take facts as well as stories about our patients and the care that we deliver to really make a change in a system that desperately needs a change that puts primary care and family medicine closer to its center.
Yeah, it sounds like it's part of the goal, too, is to make certain that we're speaking with common facts, with the same facts, as opposed to just kind of shooting from the hip, as it were. It's like, well, here are the facts, the published facts. So it begs the question as to, with 2.0, Factbook 2.0, are there going to be opportunities to update those things as they go? Because I may quote Factbook 2.0 in 2026, and I'm talking to someone maybe 12 months after its publication, and the facts have changed a bit. Is there some way that this 2.0 is going to update itself or be able to be updated?
It's one of the most important reasons we decided to do this. We think that the first version had real value. The data on which it was built mostly came from 2021 surveys. It takes time to produce a fact book, and by the time that we launched in 2023, those data were already slightly dated, and we know that there's been a pandemic, a lot of shifts in the political, cultural, and delivery environment, and it's probably time to give some updated information. So Factbook 2.0 will build mostly on 2024 data coming from the American Board of Family Medicine's Diplomates, and be able to tell you what's been happening in the last 3 years since we released Factbook 1.0.
Fantastic. So just for our viewers and listeners, could you summarize some of the goals of Factbook 2.0?
And I definitely will do that. I wanted to make sure that we mention why these data are so unique. Most of the time when you go and survey very busy physicians, for understandable reasons, you suffer a really low response rate. Out of 100 surveyed, if you get 7 to 10, you've had a reasonable day, and you know very little about the 90 to 93 you've left behind, and you may even make false conclusions, because we all know that people who have the time to answer surveys may be different from those who don't. In this case, most of our data is coming from a mandatory survey that's a small part of entry into our certification exam. So you're really getting a near census on an annual basis of about 1/10 of our diplomates every single year for many, many of the facts in our fact book. For others, we're asking graduates 3 years after they leave family medicine residency, what are you doing now? How does it reflect your training? How are you feeling about and seeing the first 3 years of practice, critical years to shaping your career? And we get about somewhere between a 50 and a 65% response rate, depending on the year that you look at, for that national graduate survey. This is a remarkable data asset that is really unparalleled in the primary care workforce universe. So that's the first piece I would note, is it's a really unique survey data source that can tell you very accurate information, we think, about family physicians. In terms of what specifically, so Gary, I think if I look at summarizing why Factbook 2.0, it's new information as we emerge from pandemic and a very new delivery environment with the most recent survey data, as I mentioned, very unique survey data from family physicians, unique not only in family medicine, but across any of the physician workforce. Another key feature is that we have put it into a web space very intentionally this time. We added a web space in 1.0 late in the process of developing it. This time, this is a web fact book. This is not a tabletop or a PDF fact book.
That's a key point.
Well, it is, and we hope that we can do an even better job of simplifying data into easily digestible graphics, but also allow the user in a web space to have a clickable link to the table, to the data, the information that actually is behind any of our graphics. So if you're looking at something and say, I really want to understand a piece of this big picture that isn't in this pie chart, this bar graph, you will actually have the ability to go in and look at the table behind it and find what you needed. For the average user, we suspect the graphics will be enough. For those who really want to understand something about a regional characteristic of a family physician doing care of children, delivering babies, they'll be able to go and look at the tables and find more information.
So if I'm hearing you correctly, the Factbook 2.0, and maybe there's going to be a 3.0, it will be something that can be updated in real time on the website as opposed to a static document?
Great question. We do intend to keep this up to date. We realize from asking a lot of those users that we probably don't need to update all facts every single year. They just don't change that rapidly. But we're on a timeline that I would anticipate seeing this updated about every third year. And that in between, as you said, if there is a fact or figure that has changed for some reason in an important way, we have the ability, as you note, to go right back to the website and change that in between versions. So it makes it a lot easier. We'll also, with the website, have a lot of information, because if you're a good consumer of evidence, you want to know where it came from. So we'll have a lot of information about the sources, about how we put together the analyses, and make sure that folks understand and can trust the data.
Fantastic. Thanks, Andrew. So in conclusion here, I just wanted to see if there was anything that you wanted to leave our listeners and our viewers, just on information, need to know information about FactBook 2.0, just kind of as your closing comments.
Gary, I think it's really important before leaving that we don't spoil your future podcast, where we're going to really dive into some of the data with other folks who've been helping produce the FactBook. But I do want folks to know that this is a space where you're going to learn about who family physicians are, where they're practicing, what they're doing, how they feel about anything from health information technology to the stresses of a modern healthcare delivery system. It's an opportunity to really dive into basic facts across a wide continuum of information that our diplomates really bless us in sharing. So it's an excellent way of getting a whole picture of family medicine as told by the family physicians. So excited to share that.
I'm excited to see this finished project because it really seems like it's a tool that all of us family physicians, actually all Americans, can use for factual data about the health of the nation. And so we applaud what your group has been doing and about to produce and put out there. And thank you so much for being here today. Appreciate your contribution to the series. This, as I mentioned, is entitled Exploring the Family Medicine Factbook 2.0. So stay tuned for future episodes in this series. And wherever you are listening or viewing this, good evening, good day, and have a good life.